Hi, I'm Pam Cipriano, First Vice President of the International Council of Nurses and also President of the American Nurses Association, the National Nursing Association for the United States. Nurses, a voice to lead, health is a human right, is not something that we should take lightly. It is so important for us to recognize that health is really a fundamental human experience that makes the difference in not only just people's lives, but the livelihood of the countries that we live in. Nurses, more than almost any other health professional, know how important that is. And nurses, being in almost every setting where people live, work, play, and learn, know how essential it is to make sure that people have access to affordable, quality health care, no matter where and no matter when. It's really critical, too, that we recognize that nurses are enablers of making sure that people have access to that care, providing the care themselves, making sure that they speak up and are that voice to advocate for patients is something that we see around the globe. It's really important when we think about raising our voices to policymakers to make sure that we advocate for everyone who needs to receive care when they're ill, that we focus on the prevention and public health needs, that we're very aware of preventing public health emergencies, that we also provide support in times of disaster or emerging illness like we've seen around the world in recent years. And nurses are the consistent voice. Not all of our countries can easily address the health needs of their people. So we must keep advocating in our public policy arenas to our ministers of health, to our lawmakers, to our other healthcare professionals about how important it is that regardless of what someone can pay for their care, we need to make sure that it is close by, that they have someone that they can go to, and that might be a nurse, it might be a formal healthcare system, it might be a number of healthcare professionals or physicians and therapists and pharmacists and others who again become very important to overall health. But we know it is nurses who are the constant advocates, who are there at every turn to make sure that we are addressing the human needs of individuals. We know that, again, health is so important. That includes mental health, physical health, spiritual and emotional health. It means security for families, to not live in fear of violence, to have a community where there's healthy air, water, and food. All of these factors affect our health. And nurses, being everywhere and in every setting, are speaking up and need to continue to speak up to be really effective voices in making sure that we can reach the point where we are assuring everyone that health indeed is a human right. It is more important to make sure people have health than to restore their health when someone is ill, because sometimes we've lost that battle if we have people who are ill. It also makes great economic sense to provide the services and the preventive services that really end up helping someone be healthy and stay healthy. It's economically important to a country to have a thriving workforce. It's very important that we support our children in having the right nutrition and ability to do well in school so that, again, they are maintaining their health. So there's so many reasons that when we focus on health as a human right, it not only helps the individual, it helps our families, and it helps our countries. I want to stress again how important it is that the voice of nurses is heard in our public policy arenas. Nurses are very intelligent individuals, and not only are they advocates on a regular basis, but they are trusted by the people that we serve, without question. And so as we think about nurses raising their voices and being able to make sure that we are leading the charge for health as a human right, we know that we have to prepare to make sure that we are encouraging and influencing the policymakers, the decision makers in our communities and at the highest level of our nations, because that's where we're going to make a difference. It is important for nurses to learn those skills and be able to execute on a regular basis so that we have made sure that the people that we serve every day know that we are fighting for them and that we will continue to exert our influence. It may not be easy, and it requires repeat visits and making sure that we have been very clear about advocating for our public, our communities, but that's probably one of the most fundamental things that we can do as nurses to make sure that our voice is heard. It's going to make all the difference in making sure that the resources are there and that our countries are valuing how important it is that we are addressing health and the health needs and focusing on how important that is for the future.